Go ahead and get started. Want to welcome everybody to the Inland Coalition on Aging meeting. My name is Dr. Ben Howdige. I'm the founding board chair. I also work at Inland Empire Health Plan. I'm the manager of integrated transitional care. I want to welcome you to our meeting, September meeting, and we are so excited because we've got some phenomenal speakers today. We have Toshira Moffett. She's the senior policy. I'm so sorry, Toshira. Let me look at your title here. She's the senior program officer with the Center for Healthcare Strategy. She's going to share a little bit about MPA work across the country. And I think that's exciting to hear what everybody else is doing or what they're not doing yet, and to hear that we're ahead of the curve, which is really amazing, thanks to all the work of everybody here that's been a part of our journey here with MPA. And then in the later half of the meeting, we have Senator Eloise Gómez Reyes, who's been a strong supporter of our efforts since the beginning, 4 years ago when we started all of this. Carmen, you remember that? Remember, Anna, when we started all of this work, we had the senator. She was
I
an
do. I
assembly member at
remember.
the time, and
Yeah.
she's been supporting us ever since. So we're very excited to have her join us in the later half of this meeting. But we're gonna go ahead and get started and just say a quick few welcoming words to you. Thank you for all of you for joining the Inland Coalition on Aging. Welcomes professionals, those that are affiliated with organizations providing services to older adults, people with disabilities, and caregivers. If you're a board member, an advisory board member, you're welcome. Professionals working in the field from all fields, aging, disability, caregiving, healthcare, universities, government entities, housing services, transportation agencies, you name it. You're all welcome. Thank you for joining us. If you have not joined as a member, though, I do want to remind you that you can join the Inland Coalition on Aging for free. There's no cost to joining. Go to our website, inlandaging.org, and register as a member. Keep in mind that if you received information about this meeting, does not necessarily mean you're a member, and you may miss out on future events, future meetings, conferences, trainings, and things like that. So I encourage you to go to inlandaging.org, fill out a membership application. Very easy, just your contact information, and that's all. And the address is in the chat. Thank you, Janelle, for putting that in the chat. And then you'll continue to receive all our announcements and get to participate in the amazing work that we do to ensure that older adults, people with disabilities, and caregivers can age well in the Inland Empire. I'm going to stop there. Thank you for those that are on camera. If you'd like to join us on camera, we welcome that. If not, it's okay. We are going to turn it over to again Toshira Moffett. She is the senior program officer with the Center for Healthcare Strategies, and I'm excited because the Center for Healthcare Strategies has been a leader in disseminating helpful information. In May, they put out an explainer, and I love that they call it an explainer because I need things explained sometimes to me. But they put out helpful resources, information. Go to their website, sign up for their updates, and you'll get to learn more about what they're doing. And especially this document here, I'm going to put it in the chat, but it's called Moving Home and Community-Based Services to Medicaid Manage Long-Term Service and Supports. If you remember, the mission of the ICA is to integrate and improve the delivery of long-term service and supports. Those are the supports that help our folks live well in the community for as long as possible. So, okay, let's move on to the good stuff here. I'm going to turn it over to Toshira. Please help me give her a warm virtual welcome through applause if you have that function in your. There we go. Thank you, Toshira. Floor is yours.
You. Hopefully you can hear me okay. Just make sure I got
Yes.
my headphones good to go, and I'm gonna pull up my slides, and hopefully I will still be able to see the chat as we have our conversation today. But if not, Ben, please let me know if there's questions or if people want to pause.
Will
Um,
do. And I forgot to mention, if you'd like to introduce yourself, feel free to put your name and organization that you're with in the chat.
All right, so I'll get us started here. So, Ben charged me with the fun task of talking about implementing multi-sector plans for aging. So thank you all for having us today. And I just want to say that our work is supported by the SCAN Foundation, West Health, the May and Stanley Smith Charitable Trust, and most recently the Henry and Marilyn Taub Foundation. So my goals today is to give you a brief overview of the Center for Healthcare Strategies. I dropped our website in the chat, provide an overview of the MPA Learning Collaborative, share the landscape of MPAs to date, and spend the bulk of my time talking about the implementation of MPAs, and then hopefully pick your brains a little bit on advice you might have for other states. So, as an overview, the Center for Healthcare Strategies is based in Hamilton, New Jersey, while I am personally based out just outside of DC in Arlington, Virginia. And most of my colleagues on the Aging and Disability team, most of us are not based in New Jersey. We're all over the country, which is nice. But the Center for Healthcare Strategies is a Medicaid-focused organization, and we really think about improving the outcomes for people who are served by Medicaid. But we also dabble in our specific lane in the aging and disability space, and that's where our team is focused. Through our work, we support activities related to effective models for prevention and care delivery, thinking about new policy solutions and programs to help states advance their efforts in the Medicaid space. And then, as I mentioned before, really thinking about equitable outcomes for people who are served by the Medicaid programs. So as I mentioned, I'm on our aging and disability team, and I thought it would be nice to share a little bit of the projects that we have engaged in over the past couple of years and are currently working on. Most recently, we wrapped up a project with the California Department of Healthcare Services and the California Department of Aging, looking at HCBS and managed care. So really doing some of that gap analysis work at the state level. We also have a project focused on integrating Medicare and Medicaid and helping Medicaid leaders think about the integration of Medicare for people who are dually eligible. Then we have we just wrapped up a learning collaborative for states that are exploring innovation and transparency in the nursing facility space. In the last few years, there's been a lot of work related to improving the quality of nursing homes. And so this work was really giving tools to states to help them think about what are the resources they need to have in place to support nursing home quality. And then you can't talk about any of this work without thinking about caregivers and the direct care workforce. And so we have a number of projects that are related to that topic area. And I linked to one of our most recent activities related to family caregivers. And so you'll have these slides afterwards, and you'll have access to all of the links that are included. And then the project that's most near and dear to my heart is the Multi-Sector Plan for Aging Learning Collaborative, which we'll spend the bulk of our time talking through today. And I'll move into a little bit more background. So this work does not happen in a bubble. There's a little mighty team that is supporting the Multi-Sector Plan for Aging Learning Collaborative. I'm not doing this alone. There's my colleagues here, Sarah Triano, who's our Associate Director for Long-Term Services and Supports and Disability Policy. Gretchen Bell, who's another senior program officer on the project, Valerie Flores and Emma Rauscher, who are program officers, and Jahira Sterling, who's a program associate. So since 2022, we've been leading a multi-sector cross-state learning collaborative. And the goals of this is to really help states think strategically about how to set up those multi-sector cross-agency planning efforts to really think about ensuring the needs of older adults and people with disabilities, and that those needs are met over the coming years. As we all know through this work that we're all getting older and we need to help build the infrastructure to support the systems that exist. And through the MPA, we're hoping that that is a good vehicle for leading a lot of those efforts. Since 2022, we've engaged in three cohorts of the Learning Collaborative. So at this point, we've worked with 27 states. We haven't directly worked with California on their MPA, but we leverage our colleagues at CDA pretty regularly because of all the great work that that group has been doing over the last few years. And so they are often someone we tap as a resource for thinking through the implementation and thinking about how do you continuously keep the plans fresh and moving forward. So right now we're working with 7 states. On the slide, you'll be able to take a closer look and see in blue, we have all the states that we've worked with in the prior two cohorts. And then in yellow, it's the current cohort of states. So we're working with Kansas, Oklahoma, Texas, Mississippi, Kentucky, New Jersey, and Rhode Island. As I mentioned before, this work is supported by a number of funders, and they've been great partners with us as we continue to move the needle in this work. So at this point, and so at this point, there are over half of states that are working on MPAs. At this point, there are 16 states that have some form of authorization, so executive order, legislation, or other decree that has allowed states to move forward in this work. And as of August, 12 states are implementing MPAs. The states that are implementing are, as you know, California, Colorado, Maryland, Massachusetts, Minnesota, New York, North Carolina, Oklahoma, Pennsylvania, Texas, Utah, and Vermont. And in the last couple of years, there's been some momentum at the federal level to come up with a strategic framework for a national plan on aging. And that work was led by the Administration for Community Living, in partnership with our funding partners and a number of other philanthropic partners and several federal agencies to really think about how do you shape this at a more national level. And a lot of their work was informed by the activity that was happening at the state level. So a little ad break for the multi-sector plan for aging website. I dropped this in the chat also, but this is a great place to go to find issue briefs, other resources about what's happening across the different states. And then also if you're interested in, if you're working on a state plan on aging and you're thinking, okay, how does this relate to an MPA? There's a issue brief that focuses on that topic specifically. There's a little graphic that has a checklist that shows you the differences and similarities between those two planning efforts and how states are thinking about bringing those two things together. And then there's a map on the site as well where you can access links to states' MPAs. Also, the map is updated as new states either move into public comment on a MPA or have started implementation. So the map is like a moving target at this point. So it's a good place to kind of stay up to date on what's happening. And then there's also a newsletter where you can keep up with other MPA related news. So to jump back into the work that we've been engaging in with the states is through the Learning Collaborative. The states that we've worked with have come into the process in varying stages of development. There are some states that come in and say, we don't have an executive order yet. We don't have legislation. What's the pathway that we need to pursue to think about that? Then there are states who have already, so they're doing a lot of the work in identifying the need, trying to secure buy-in, gathering some of that initial input, just to start to build the ground and foundation for getting support with developing an PA. Then there's the other side of it where there's states that have gotten an executive order or legislation, and then they're starting to like build their subcommittees and work groups and identifying what their goals and priorities are going to be, doing some of that community engagement, getting input on drafts and that sort of thing. And then there's states that have plans and been implementing, so Massachusetts or Colorado. They've said, we've been implementing for a while, and now there's an opportunity for us to reflect on what we've done so far, where there are opportunities that we should update and kind of go from there. And so we have worked with states through those different stages and helping think through what are some best practices on how to engage different stakeholders. So if you want to say, incorporate more of the people with disabilities in the conversation. What are some strategies and tools for doing that? If you want to reach out to, in this context, rural communities, what are some approaches for engaging in that way? And so really thinking about those approaches. And then just to pull in that next level, there are some states that are really thinking about how do you implement this at the rural or local level? How do we translate what we've done at the state level to the more community focused level? And I pulled this from the Rural MPA toolkit, and there's a lot of similarities in the development process for both. But then you get more of that community insight as part of even more of the community insight, I would say, as part of the process, and being able to tailor some of the things that happen at the state level to what you might want to focus in on the community level. And I highlighted here in this little box in red that it is kind of a cyclical process, and just reflecting on where you all are is that you're kind of in this phase of thinking about the implementation planning. How are you going to take that time to evaluate your progress? How do you ensure accountability, sustainability as part of the process? And then it all kind of repeats throughout. So one of the other things that CHCS is working on is thinking about like what's a toolkit or resource guide. So we're pulling together a lot of our existing resources and adding new content as we've learned more from working with states, of examples of what to think about as part of the implementation process. There's the first part, which is not included here, but really thinking about well, it's actually included in my next slide, but thinking about like how do you continue to engage stakeholders and subcommittees through the process? And then also how do you think about tracking outcomes and the progress? Um, and so as part of the toolkit that will be coming out later in the year, we're really going to hone in on the things that you should be thinking about as part of that implementation and tracking process. There's not at this point, because yes, there are 12 states implementing, but a lot of the states are really early in that tracking the outcomes piece. So I think we're in that, the phrase that I hate to say is we're building the plane as we're flying it with a lot of it. But California has done a lot of great work where they have a data dashboard that has a focus on aging related data, but then they also have the implementation progress tracker where you can see here are all the goals. Here's what we focused in on the first 2 years. Here's where our progress has been against those goals. And here's been what some of the outcomes are. So that's more on like the very sophisticated end of tracking progress. And then there's more the simpler ones where it's been a one pager or a spreadsheet that captures like here are the milestones and metrics that we've been tracking, and here's a one pager that shows what we've accomplished over the last year. And then there's Massachusetts, which has done annual reporting each year of their plan, where they produce a report about all of the goals and activities that they have completed over that year, and they seek public comment so that that helps inform what they may want to elevate for that next year. And they just went through a full refresh process in the last couple of years and released their updated plan. Um, and I linked to that in this deck as well. And I think the other piece that, as we've been talking to states, as they've been developing their plans, they've really had a lot of that active committee engagement and support throughout that process. And so the question for them now is, how do we keep people involved in the process? And this is where the implementation part is really important and key to the process is thinking about, here's the subcommittees based on the areas of focus or domains in our plan. What roles and jobs do we give each of those groups to charge them with being accountable for tracking the progress and success of those activities? Do they have recommendations of things we should change for the next year? And so giving them assignments as part of that process really helps ensure that that accountability is happening. And I think the other piece, yes, there's the subcommittees, but there's also how do you keep the community engaged in the process too and aware of what's happening? There's a few states that have been exploring this on the their state level. So North Carolina has their I'm Still Here campaign where they really are highlighting the interests and needs of older adults in the state. Oklahoma has their ambassador program where they train individuals to talk to the community about the MPA and the progress that's being made and seeking input on things that the state should be thinking about. And then Massachusetts has a toolkit with messaging and social media resources and a number of other tools that community members can use to help promote the MPA that they're working on. And then through the work groups and kind of like your reflection period, it's really nice to take that pause at just intervals that you all decide as a group make sense to check in and say, here's where we've been. Here's where we might want to make adjustments. We're not really making momentum here. Maybe we should adjust this here. There's a new issue that's coming up that we need to think about. Taking that time to reflect and see if there's updates that you would like to make. And if there's stakeholders that you haven't involved before that you really feel like are important to the process now, incorporating those voices as part of the work. The world that we're in right now, there's a lot of state and federal policy changes that are happening and funding shifts. And having that in mind helps you think through if there are any modifications that you would like to make as part of that process. And so thinking about dashboards and tracking and aging related data. Another project that, and I'll drop this in the chat when I'm not screen sharing so that you can take a look at that, is the National Aging Readiness Dashboard that West Health has created. It's intended to be a tool for states that even if they don't have their own state dashboard, they can go to this site and look at a number of different metrics. So looking at health status or looking at mental health data. This is the first version of that site, and the West Health team is going to continuously update that information. But I wanted to highlight it as a resource that you all could look to if you want to have a picture of what's happening nationally on a set of different indicators that are of interest. And we're always seeking feedback and input on other data elements to include. It doesn't go to county level yet, but that's kind of like a future vision of where they would like it to go. But I wanted to highlight that as a resource. So I think this is my last slide, but would be curious to hear from you all. What have you seen as the most valuable result of creating a local MPA? What's been most challenging? We're working with a number of states that are thinking about doing this in their communities. And so, welcome any comments or thoughts you all would like to share about that. And also, if there's advice that you would have for states that are thinking about that, like, are there resources that you wish you had from the state level that could be really helpful? Um, so, yeah, anything you would like to share. So, I'm going to drop my screen so I can see everybody. And I see a hand. Isabel?
Yes, good morning. My name is Isabel. I'm a delegate, and I would like to ask if anything with the new administration will be cutting any funds for this, or nothing is going to change.
That's a great question. And I know states are thinking about so I will first start by saying most of this work is like, out of people's existing budgets. It's usually added on to someone else's role. So it's usually maybe it's the director of an agency that is also the multi-sector plan for aging lead. So a lot of states are thinking about that. Number one is what that might look like. Number two, I would say states are also thinking about, where are there opportunities to collaborate and share funding across agencies? Because there are cuts to Medicaid that's just happening. And so preparing for those changes has been one of the benefits that we've heard from different states is that because they've formed relationships with either the Department of Transportation or the Department of Housing, thinking about that. And then also if there's been external funding. So I know Maryland had technical assistance funds for a housing program project that the Department of Aging was working on with their Department of Housing. And so they used a lot of the funding for those types of activities to support other work, but it is definitely top of mind for states as they're thinking about where can we leverage our relationships and existing funding and how can we partner in a different way.
Thank you.
You're welcome.
Hi, Trishara. This is Ben. I'd like to echo what Jax just said. Great point. He wrote, I think the most valuable result has been the opportunity to initiate consumer-focused conversations across government agencies. I see that Carmen agreed with that also. That's exactly what I was thinking. It's been amazing to bring us together, those who serve people with disabilities, those who serve older adults, and those who serve caregivers, because there's an underlying need that we all share, that these folks share, and that's long-term service and supports that are community-based, in the home, in the community. How do we support people? How do we support the caregivers that are supporting these folks? And how do we prevent placement in a facility if that's not their choice? How do we support their independence in the community, right? Transportation, housing, and all of these things that are needed. So I agree. Thanks, Jex. If you want to add anything to that, wholeheartedly agree with that.
Yeah, and I think that's come up a lot from this at the state level is that it's allowed them to come up with solutions and think about partners that they had not partnered with before. So we had a conversation yesterday where one of the activities that came up was connecting senior centers with students who were and connecting the summer meals program. And so the senior center was able to get some additional funds to help support students who wouldn't necessarily have access to summer meals. And so thinking about like how do you bring those intergenerational kinds of relationships together, and thinking about like how do you use your funding in a different way that serves a need for multiple people. Well, I'm gonna drop the aging readiness dashboard link in the chat so that you all can take a look at that. And I see another hand,
We have
Elizabeth.
time for one more question. Elizabeth.
It's not really a question, but more of I'm interested in your opinion on engaging people across sectors. So I am leading our implementation teams. It's a little plug. Hopefully everybody can come and join our implementation teams. If you're interested, please send an email over to our email, Inland Coalition on Aging email. But the question that I had is, we are working across sectors in implementation teams, and so a lot of times we have expertises that are unique to our teams or unique to our field. But figuring out ways to share those within our teams and to encourage kind of thinking outside the box and sharing resources outside the box. I'd love to hear maybe some ideas, just like you had shared with the intergenerational summer lunch program, some ideas that you've came across with different states and regions.
Yeah, so I think Minnesota is the one that comes to mind for me because they have so many different work groups and action teams. So they refer to theirs as action teams. And some of them serve, there's sometimes a person who serves on multiple groups. And so that's been one way that a state has tried to leverage some of that. I think it's always hard to do it, but if there's like a little subgroup of people who can be a liaison between the different work groups and identifying those areas of expertise and where there could be places to share that in another group or a way to think like have another kind of convening to bring people together. I think that's an interesting way to do it. And the last example I'll share, because I know we have another person presenting today, but North Carolina does, I think it's monthly or bi-monthly webinars where they have a speaker present on a specific topic area. And so it's an open webinar that people can come to and share information in that way. So there's a couple of different models that could be applied.
Thank you. That's super helpful.
Welcome. Well, thanks for having me.
Thank you, Tershira. Appreciate your presentation. Folks, please go to the website to get more information on what we talked about today and sign up for their updates. I found it very helpful to read their resource material. So thank you again, Tershira. We appreciate your participation today. Look forward to more conversations.
Welcome. And I dropped my email in the chat as well.
Thank you. Thank you. A round of virtual applause, please. Well, we are going to move on to our next agenda item. And again, I am very excited to welcome our next speaker. As you've heard me mention early on, we are very excited to welcome Senator Eloise Gómez Reyes back to the ICA. I want to mention Senator Eloise has been with us since before we even had a name, I think. The first year that we met, we were just a group of folks eager to start this journey on developing a master plan for aging. And when we connected with the senator, she was an assembly member at the time, and she gracefully jumped in to help and to support and to provide us updates of what was happening at the state level. So we are very excited to have her back. Please help me give a warm welcome to Senator Eloise Gómez Reyes, who's going to share with us some of the work that she's been doing at the state. And a great big welcome to you, Senator. Thank you for joining us this morning. And thank you to Prince and your senior district representative who helped connect us and is always very supportive of our efforts. I'll turn it over to Senator Eloise Gómez Reyes.
Hello, everyone. It's a pleasure to be here with all of you. I just texted you, Dr. Ben. I want a bit of just a few more minutes for the senator.
Oh,
As you know,
absolutely.
because of her just her health at the moment, she's getting into some medicine and then she'll be on. Just give us a few more moments, okay? So you can
No
continue
worries.
for now, and then we'll jump on in a second.
Will do. Thank you for letting me know. Thank you. What we'll do right now is we have some announcements. Carmen, would you be able to provide some announcements?
I'm sure. So some of the announcements that we have, as Elizabeth mentioned, our action teams are meeting. We're now meeting on a monthly basis. If you want to participate in one of the action teams, we have a total of 5 right now. We're going to be creating a 6th soon. If you're interested in participating in the action teams, it is a commitment. Part of the work of the master plans for aging is now implementing them, right? And so for that, we need to more meetings, more discussion. And so please consider participating by joining one of our action teams. We began meeting on September 9th, and we meet on every second Tuesday of the month at various times. So there's a time for the housing action team, transportation action team, caregiving, Alzheimer's and other related dementias action team, as well as equity, justice and safety action team. So if you want to be involved, please send us a message at info@inlandaging.org. Also, we continue to do targeted outreach. We have the plan, we have the blueprint, we have to share it and try to get as many communities involved in its implementation. I conducted a presentation earlier today to the Menifee Senior Advisory Committee. I shared our plan with them and how we can collaborate with them to implement the plan in their community. I might also, right after this, have another presentation. I'm going to be participating on a panel with the Inland Empire Community Health Initiative on understanding health literacy. So that's right after this one. So I'm jumping from one to the other because it's important that we get as many individuals involved in implementing the plan. On October 15th, we'll be presenting to the San Bernardino County Senior Affairs Commission. And we've also been invited to present at the Riverside County IHSS Caregiver Appreciation events. And so a lot of presentations going on because the work has not been done, right? We created the plan, we have to collaborate. That's the key. That's the key right there. Collaboration between organizations to make sure that the plan is a success. Do we have other? So those are the updates. Elizabeth, yes.
Hi. So also another plug in November, we're going to be starting our communications action team. And that is for anybody who's interested in doing this sort of outreach to stakeholders, to those within the community, and also to providers and professionals. And we have lots of really fun, interesting activities planned for that. And if you're interested in joining that particular working or action team, you have a say kind of in what it looks like going forward and creating what it can be and all of its potential. So if you're interested, send over an email to info@inlandaging.org.
Yep. Thanks, Elizabeth.
Thank you, Carmen. Elizabeth is our consultant, and she's been helping us to form and moderate, facilitate the subcommittee meetings. We highly encourage you to join one of them. This is a coalition, which means the strength comes from its membership and your contribution to all the work that we do. We can't do this without you. And so hope you consider going to the website, seeing all the committees that are available. And one of them is probably going to interest you. If you work with housing, with transportation, with caregivers, with dementia, there's more. And I could see many of you as a good subject matter expert in those committees. So Elizabeth, not to put you on the spot, but anything you want to add to that to let the folks know about the committees?
Yeah, so I was about to put a message in the chat, but we're trying to make these committees so that many hands make light work, so that we are all carrying a little bit together, and it's not beyond any one of our capacities to lift and to be able to support our committee and our community. So I really encourage you even just to try out a meeting. I'll post the info in the chat. That way you can send over an email and we'll get you on the email list. But try out a meeting, see if it's for you. If it's not, that's okay. And if it is, we really hope you stay and help support the community and the master plan for aging.
Thank you, Elizabeth. You know, one thing as we're waiting, there is one thing we forgot to do in the beginning, and that's just to welcome everybody and tell you about the ICA Inland Coalition on Aging. We are here to improve and integrate long-term service and supports. Long-term service and supports are those things that help seniors, people with disabilities, caregivers, really to live independently in the community as best as possible, right? What do folks need as we age? By a show of hands, how many of you are aging? I love asking that question because it is true and it is very applicable. It's applicable to all of us that are aging, right? We all need to think about what we're going to do when we age. How are we going to age? Where do we want to, not just I'm going to retire and stop working. Believe me, aging requires more than just that planning, right? We need to think about what we're going to do, what we're not going to do, what we want to take up, or what do we want to continue on as, you retire and move on from one thing, what are we going to move on to in the future? What are we going to do in the future? So, Inland Coalition on Aging is for everybody that is aging, but most importantly for those that serve these communities, right? As I mentioned. So, we hope you will join us and continue the work that we started 4 years ago. I still can't believe it's been 4 years. So next year we'll be celebrating. We'll have to celebrate Carmen and Anna, speaking here to the board members, that we'll need to celebrate our 5-year anniversary. But we've been on this mission, very steadfast focus on developing an Inland Empire Master Plan for Aging, and we've successfully done that. We launched it back in June with the support of both Riverside County Board of Supervisors and San Maria County Board of Supervisors and other elected officials like Senator Eloise Gómez Reyes. They've been tremendous help since then. And what this means is that we have a plan, a blueprint for aging in the Inland Empire, right? This plan you can take to your organization, you can take it to your advisory committee, to your board of directors, to your county director, and see and read what are the needs of the Inland Empire. How can we support people with disabilities, older adults, and caregivers to ensure that they have the services that they need? We spent 4 years gathering information, having focus groups, and really making an intentional effort to touch all of our communities in the Inland Empire. And this plan here that you see on the screen, this is what the plan is all about. And in there, you'll see all of our goals listed. We have goals that address housing and home as healthcare, transportation for all ages and stages, caregiving, Alzheimer's disease and related dementias, age and disability-friendly behavioral health and social support. 5, safety, respect, and equity in aging. So one of those, I'm sure will intersect with the work that you're doing. So I encourage you to peruse through that plan, find your section of interest, read that, and then connect with one of our committees that's doing the work. We need you. We need you to be a part of this. We can't do it on our own. Go to the website, inlandaging.org, and see where we're at. Right here, you see on the screen a map of project progress. We gathered information and recommendations. We developed a report on project specifics. You can see the full report there that we had initially, and then we launched the full IEMPA in June. You can download that document there. But now the work begins. The work begins now. Even though we've done 4 years of work, the real work begins now, and that's because we need to implement all of our goals. All the work that we've done up until now we need you to take on this work. And so the committees that Elizabeth is facilitating, eventually she's going to hand that over to you, committee members. And so we're going to need a chair, a vice chair, maybe an advocacy person to lead the advocacy efforts. And so there's a place and a role for everybody in these committees. Elizabeth, I see your hand up. Please join the conversation.
Oh yeah, you're filled with so many awesome ideas. So I just wanted to also say, even once you look through the master plan, if you see that things that your organization or community are doing align with goals of the master plan, even if you're not actively participating in the action teams, send us over an email. Let us know about those projects that are happening so we can support them, so we can share information about them, but also so that we are aware that they're going on. One of the key issues that we found across all of these goals that we created was there's a lot happening, and we just need to educate the community on what's available. So if your organization or your jurisdiction is already doing something, let us know so we can get that information even farther out to the community. Regardless if you're participating in an action team or not, we want to hear about what you all are doing.
Absolutely. Is there anybody here that works with transportation? Raise your hand. The reason I mentioned that is because it was interesting as we started looking into what were the needs of the Inland Empire. Thank you, Jillian. I see your hand up. When we started looking at the needs here in the Inland Empire, we definitely got some specific input about the needs here. You know, we looked at California and what the needs were. Then we looked at the Inland Empire, and transportation was one of those things that was called out, especially in the Inland Empire. And I'm sure if you work in transportation, you know the needs, you know the gaps in services. And so that's a committee that we have. We need some folks in that committee to help us with transportation to and from. Jillian, thank you. Medical appointments, but even beyond that also, right? We need folks to be able to get to grandchildren. We need folks to be able to get to employment. We need folks to be able to get to their volunteer opportunities. We need transportation to be available to folks so they can participate in life fully, so they can be active and engage in all that we do as community members. I am going to transition now. I see that Senator Eloise Gómez Reyes has joined us. It's so good to see you, Senator. We were just reminiscing about the past 4 years and the work that we've done, and you have been along with us since the beginning, since before we even had the name Inland Coalition on Aging. You joined us in the beginning, supporting us all along, and I'm just so grateful for your support and all the coalition members that have been here with us since the beginning, and the new ones, because the work is just beginning. The work is just beginning. Now that we have an identified Inland Empire Master Plan for Aging, now the real work begins. And so we welcome you, Senator, to the meeting here today, and we give you a big, warm welcome and hug. We know that you, thank you for sharing. You've shared some health concerns with us, and we're so happy that you are well and here with us today. But again, let's give Senator Eloise Gómez Reyes a big virtual round of applause.
Thank you so much. It's always good to be around you guys because I learned so much, and I get to take a lot of that back to Sacramento. I do want to begin by thanking Ben. Ben, it's just working with you with IEHP and now the Inland Coalition on Aging. This is pretty awesome. I love it. If I can get I don't know if I'm. Anyway, so without a doubt, your work is essential to ensuring that our seniors are not only cared for, but also celebrated and empowered to live full, vibrant lives. This is something that you have done since the very beginning, before you had the name, as you said. And I think you're the sorts of people that I want to partner with, because I know that whatever you do is something that benefits all of our seniors. Here in San Bernardino County, older adults age 60 plus comprise roughly 390,000 individuals. And by 2045, we've seen all the statistics that this group is projected to make up 19% of the county's population. The demographics this shift underscores the urgency of preparing for the future of aging in our region. you have worked on this master plan. It's the input from everyone in the community, especially those who are seniors like myself, because my mother reminds me whenever I tell her, Mom, I'm going to be doing our Senior Advocacy Week. You remember, Ben, when I've shared about that. And we dedicate 1 week, and it is for our seniors, where we go to senior housing, we go to senior centers, and we spend the entire week on this. It takes a lot of planning, and we want to make sure we get all of our communities, all of our cities, but it's one of the best things that we do. And we get so many ideas from our seniors because of the questions that they ask. But that's why when I get to get together with you specifically, but now with a new group, this is very, very important to me, because I know that as issues come up, we know that we have to continue to bring the conversation back to our seniors, because one of the things that I think bothers me the most, and I was talking to the chair of our housing committee, and she absolutely agrees, and this is something that I think we're going to work a little harder on, is that when we think about homelessness, we see the statistics, for years it was our very young LGBTQ, our former foster youth. The group that is increasing the fastest is our seniors. So we need to find ways to make sure that our seniors get to stay in their homes or where they are living for as long as they can, to maintain that dignity for as long as they can. There comes a time when we do need more help than we can get at home. And we need to be able to know that we're going to be able to transition and have the protections all around us. That's really important. Having the organizations like yours, making sure that we get the information to our seniors, it's very important. I will tell you that we always have an interpreter. Almost always we will have somebody who will translate in Spanish, or if I'm speaking, I just speak in English and Spanish. But we also have Mandarin for some of our areas. But one of our interpreters who was interpreting in Spanish, and I got to share this with you, when he interpreted seniors, he used the word ancianos. And I mean, I just cringe when I hear that, because that's the way we used to refer to our seniors. And I told him afterwards, I said, it's not ancianos. Ancianos are the ancients. We're not the ancients. That's long ago. Those are our great grandparents. We are now seniors, and you've got to refer to us properly in Spanish also. But getting back to what I wanted to share, as your senator, Ben, you know that I am committed to advocating for policies that improve the quality of life for seniors by expanding access to healthcare. That's a problem. We know that we're going to have serious problems coming up, but that's something that I'm absolutely committed to. Strengthening long-term care services. This is something that I've partnered with you all and also with our ombudsman to make sure that we have protections there. Ensuring affordable housing goes back to making sure that our seniors are not spending all of their benefits on housing, and we see housing rents going up, and that's a complaint, a concern I hear from many of my seniors. Also supporting our caregivers. They play such a crucial role in the lives of our older adults, and we have to make sure that they are protected, that they are supported. And in the end, that's why meetings like this are so important. Your meeting is timely. As you know, this is our 9th annual Senior Advocacy Week. It started yesterday. And as I mentioned, this is our week for our seniors, and to be able to spend a little time with you is very important, always important, even if we do it by Zoom, right?
Yes.
That's as long as we get together and we get to hear each other. But you mentioned earlier about my health issues. You're right, Ben. I was diagnosed in the end of last year with cancer, and had to undergo surgery, 14 hours with 2 teams, and been hospitalized for a while. And then my chemotherapy, very strong chemotherapy. I can talk about that now. I couldn't then because I was just living through it. And it's left me with some neuropathy. But one of the things that I have found as I talk about it is how many people have suffered with cancer. Some of them younger, but some of us a little older, and then having to deal with all of those issues, being diagnosed and now having to have somebody care for us. These are all important things. More and more people are being diagnosed with cancer. We've got to make sure that we have the right caregivers for them. I'm very, very lucky. My husband and my son, 24/7, they've had no rest. The rest of my siblings too, but this is stuff that is very important to me. Something that many of my seniors, it surprised me that it's come up so often. They say, what about all this pollution? What are we doing? Well, I'm really proud to tell you that we were finally able to get in this budget $250 million. It's going to go every year, not just once a year, and then we have to beg for it again, but every year, $250 million to those communities that are identified as being the most vulnerable, the most polluted. And San Bernardino Muscoy has already been identified. And in addition to that money, the oversight and the accountability has now increased because of a bill that was just signed by the governor that I authored. And we're now going to have the Environmental Justice Bureau in the Department of Justice with our Attorney General to help enforce that. And I'm very proud of that. Making sure that there's so much work that has to be done, and making sure that we deliver to our seniors. And these are things that we will continue to do. I want to hear from your members and from you, Ben, about things that we can do. We're going to get started with our new legislative session in November, December, as early as October, where we start looking at ideas for legislation. So if you or your members have ideas for new bills, please let us know about it. We carry at least one bill that has to do with our seniors every single year. Sometimes they don't make it to the governor's desk. Most of the time they do. And I'm very proud of that work that we have done. And of course, we have legislation in other areas that, that also, they may not be directly for our seniors, but it's our seniors' families, like the Know Your Rights Act that's sitting on the governor's desk. And this is to make sure that if at your workplace there is a police raid or an ICE raid, your family will be notified that this has just happened, so that they know that if you don't come home, that this is where they can look for you. Another one is that we recently lost 2 students. There are others, but 2 students who died by suicide. And we want to make sure that those highways, those overpasses are protected. So we worked with Caltrans to make sure that we could put legislation together that they would agree with. And that bill is also on the governor's desk. Among others, that's just 2 of the many bills that we have on the governor's desk. But Ben, in closing, I just want you to know how excited I am that we get to have this conversation. And I want you to know that I want to continue to have these conversations, because those innovative ideas are going to come from you. Those strategies I know are going to come from you and your coalition. And I'm looking forward to working with you, making sure that our seniors remain independent. They get to stay home as long as they can, that they're protected, that we're sure that whatever benefits they're entitled to, that they get to the right place and they get all the benefits they're entitled to, and the increases when those are needed, that they know that they have legal aids available to them, the Department of Aging, and of course, the Inland Coalition on Aging. I appreciate all that you do and all that you're going to do. And I thank you for inviting me to be here so that I could chat with you, and just so pleased, so proud of all the work that you do, Ben, and now the Inland Coalition on Aging.
Thank you, Senator. Thank you so much for your kind words for the coalition members and all the work that they've done these years to get us to where we are. What's exciting is the subcommittees that we talked about earlier. Those are the ones that will probably come up with ideas on what legislation. And so we'll be sure to stay in touch with you and share those with you. Again, if we could give Senator a big round of applause for her support all these years and the years to come, as now we implement this master plan for aging. Senator, I did want to mention to you, I don't know if we shared this with you, but because of all the work that we've done for the past years and our commitment and the commitment from San Bernardino County was admitted by AARP into the Age-Friendly Communities Network. And so
wow.
That means the work is beginning again. That means it's a commitment from San Bernardino County and all of us that are part of that coalition, this coalition, to continue to improve the lives of people with disabilities, seniors, and caregivers in our Inland Empire. So thank you again, Senator, for your advocacy at the
Thank
state
you.
level, for partnering with us. We welcome you anytime. And tell us, hopefully you have a great Senior Advocacy Week this week. We wish you well.
Thank you so much. Have a wonderful day, everyone.
Thank you,
Bye-bye.
Senator. With that, this concludes our meeting. We try to end right on time. So thank you everybody for joining us. Please go to inlandaging.org, sign up as a member, sign up for one of our committees, and thank you for all that you're doing to ensure that older adults, people with disabilities, and caregivers can age well in the Inland Empire. Take care, everyone.